Hello and welcome back. Are you also thinking about liposuction? If yes, then this video is for you, especially if you are thinking about your tummy liposuction. One of the most common mistakes that patients make is getting only the front of the tummy liposucked. Your body is not a two-dimensional structure, it's a 3D structure, and that is why you always need a 360-degree liposuction. That is, you always need to get your lower back, your flanks and your tummy treated together. And if you don't do that, the results, they don't look good. In today's video, we'll discuss a similar patient in whom we did a chest contouring, the front of tummy, the flanks as well as the lower back to give a very smooth result, and how we did his liposuction using VASER and power assisted liposuction. If you are also thinking about liposuction, this video is for you. Hello friends, my name is Dr. Ankit Gupta and I'm a plastic surgeon and I practice in Delhi, Pitampura. Now friends, many a times when we look at our tummy, we see that our tummy is protruding and we think that we should get our tummy liposucked or we should get a liposuction of the tummy area. So this is the biggest mistake that most of the patients do. If you treat an isolated area, only that area will become thinner and you look disfigured. What my advice to all my patients is, you are a three-dimensional structure, not just in a 2D. You just cannot make your tummy go flat and the flanks are still fuller. Ideally, what you need to do is get liposuction of at least your lower backs, your sides as well as your tummy. In case you have a heavier chest, especially in male patients, you should ideally get a chest contouring along with your tummy, sides and back area. If you see this guy, in him, if you see closely, he has protruding chest. He had pseudogynecomastia along with a very little portion of gland causing gynecomastia. He had a fat in his tummy which was protruding out of his muscles. He was otherwise doing a lot of gym and exercise. He has done a lot of dieting, but this stubborn area of fat was not going away. And he wanted something to get rid of this fat so as to boost his ego so that he can feel confident again. The flanks were there. And if you see the back, the lower back had a lot of fat. Now, if you try to treat the flanks only from the front, the back portion of the flank area will always remain. So, and that is why I always stress that whenever you get liposuction for the flank area, it should be done both from the back as well as from the front. So what we decided for him was, number one, a proper planning. After doing all the investigations and seeing that he is fit for surgery, we did the marking of this patient. In the marking, as you can see, we marked all the areas that had excessive amount of fat. Now sometimes patients, they question that, sir, will this fat come back? So let me take this time to explain you that once we do liposuction, we take out the fat cells, and once the fat cell is taken out, they cannot regrow and the fat cannot accumulate in those areas. But yes, you are supposed to follow a healthy lifestyle and you're not supposed to gain a lot of weight, because if you do, the fat will get accumulated in other areas of your body. So liposuction is meant for as a body contouring thing. That is, once you have established you are doing a lot of exercise and dieting and still there are stubborn areas which are not going away, or else you are in a stable weight range and you want some contouring to your body so as to chisel that area of the body so that you look much fitter, you get what you desire. In him, he wanted to get rid of the flank, so we marked the flank area from the back as well as from the front. We also marked his tummy area, especially in the lower tummy. We also marked the chest area which he was concerned about. For him, we decided to do general anesthesia. We did a VASER liposuction. For that, initially we made him lie on his tummy. We did his back liposuction. We took out fat from his back, and then we turned him, and then we did his chest liposuction. In all these steps, we always do infiltration, then we do a VASER to melt the fat, and then we use power assisted liposuction to suck out all the fat that is possible. In the chest area, we also took out a little bit of gland from both the chest, and that is the gynecomastia part of it. In the tummy area, we again did the infiltration, the VASER and the power assisted liposuction. On table you can see the difference. This is the fat that came out of the patient and this is his result after only 2 days. Now the benefit of liposuction is you don't have to wait. You see the results immediately on table. Once the fat is taken out, you immediately see the reduction in the inches. After the surgery, what happens is you gradually start developing a bit of edema, that is the swelling, and this swelling increases for initial 2 days and gradually starts to go down. It can take up to a month for the swelling to subside and 3 months for the final results to happen. But that doesn't mean that you won't see your results immediately. You see the decrease in the inches immediately after your surgery. After the surgery, it is very important for you to wear a pressure garment. Now a pressure garment is a jacket sort of a thing which you need to wear after your surgery. This helps in multiple ways. Number one, it will help prevent any bleeding. Number 2, it helps in your healing. Number 3, it helps in decreasing the chances of seroma and gives you comfort. It helps in your skin getting adhered to the underlying tissue because we have taken out a lot of tissues from in between. Wearing a pressure garment is a must, and if somebody is not ready to do it, we cannot operate the patient. After the surgery, you can also opt for lymphatic massages, which helps in decreasing the swelling even faster. I prefer to put drains for about a day till the time you are admitted in the hospital, so that all the liquid that is inside is drained out within those drains, and I remove them the next day before your discharge. I prefer to keep my patients for at least one night at my nursing home for your proper recovery. Since there is a lot of fluid shifts during liposuction, it is advisable that you stay overnight. This is the result of this patient. In case you are looking for liposuction or you have multiple questions regarding liposuction, do follow our playlist. We have made multiple videos on liposuction. You can get a fair amount of idea about it. You can also subscribe to our channel, on which we regularly update videos related to plastic surgery. In case you want a personalized consultation, you can book it on the WhatsApp number displayed. Thank you and have a nice day.